Welcome, Thomas. Today, we're going to delve into a critical area within perinatal palliative care, navigating anticipatory grief and the planning involved. This topic is profoundly important for providing comprehensive support to families facing life-limiting fetal diagnoses.
Thank you, Sophie. I'm eager to understand this better. It feels like such a delicate balance between acknowledging the grief and helping families make practical plans during an incredibly difficult time.
Precisely. We'll explore how to approach these sensitive discussions, focusing on both the practical aspects of planning and the emotional landscape of anticipatory grief, ultimately guiding families towards embracing their unique journey. To begin, perinatal hospice and palliative care, or PPHC, is crucial for families facing life-limiting fetal diagnoses. It provides essential support in navigating anticipatory grief and the complex care decisions that arise.
What exactly does anticipatory grief entail in this specific context? Is it different from grief experienced after a loss?
Anticipatory grief involves processing the profound loss before it physically occurs. PPHC specialists help families process prognostic information, grieve, and plan, facilitating meaningful memory-making activities during this period.
So the support extends beyond emotional processing to practical planning. What kind of planning is involved?
Indeed, despite poor prognosis, some families choose to continue pregnancies to term. In these cases, PPHC assists in developing comfort care plans to cherish the time they have with their baby, however brief.
That makes sense. It's about maximizing the quality of the remaining time. So PPHC helps families process grief and make these critical care decisions.
Exactly. This leads us to the significant concept of parental identity within PPHAC. The idea of being a good parent profoundly influences decision-making and communication.
How does the concept of being a good parent manifest in these difficult situations?
Parents often define good parenting as advocating for their child, making unselfish decisions, and ensuring their child feels loved. These definitions guide their choices throughout the process.
And how does fulfilling this role impact their ability to cope with the eventual loss?
Success in fulfilling this perceived role helps parents navigate loss and find peace. It minimizes feelings of guilt or regret after their child's death, which is a crucial aspect of long-term coping.
So their sense of agency and purpose in these decisions is vital for their emotional well-being later on.
Precisely. It empowers them in a situation where they often feel a lack of control. This brings us to the importance of communication and prognostic disclosure in this planning.
What is the role of communication, especially regarding the prognosis, in supporting these families?
Honest and complete information about a child's health status supports parental hope, even with poor prognoses. It allows them to make informed decisions and prepare.
Do parents typically want all the information, or do they sometimes prefer to limit it?
Parents often act as gatekeepers of information. Healthcare providers should respect and follow their lead in disclosure, tailoring the information flow to the family's needs and preferences.
So PPHC supports families through anticipatory grief, helps them define and fulfill their parental identity in decision-making, and ensures sensitive, honest communication regarding prognosis and planning.
That is an excellent summary, Thomas. These integrated approaches are fundamental to providing compassionate and effective perinatal palliative care. So, Thomas, to recap, we've thoroughly explored anticipatory grief, the profound influence of parental identity on decision-making, and the absolute necessity of sensitive, honest communication in perinatal palliative care. For your studies, try to visualize how these elements intertwine to create a holistic support system for families. And remember, connecting the good parent concept to minimizing guilt and regret is a key takeaway.
That's a very helpful summary, Thomas. I'll definitely focus on those interconnections, especially how fulfilling that parental identity role directly impacts long-term coping. I'll also make sure to review the nuances of information gatekeeping by parents.
Perfect. You've grasped the core concepts well. For our next session, we'll delve into the practical aspects of creating comprehensive birth plans and post-delivery care, ensuring every precious moment with the baby is honored and cherished.